Now, what's the first thing you think of when someone says surgery?
Normally, a lot of people think about all the blood that's involved. Well, CBS 2's Dr. Max Gomez tells us about a growing trend, bloodless surgery.
You might expect little Andrew Craver to bounce back from surgery like this after a few weeks. But what he went through and how well he's doing has medical experts taking notice.
He was up walking around the next day?
Yeah.
Yeah. And I think within a few days he was riding a bicycle again.
But it wasn't routine surgery Andrew had. His case was historic.
One of the smallest children ever to receive a heart transplant without blood.
Dr. Mark Galantowitz of Nationwide Children's Hospital led the effort that required meticulous planning and teams of medical experts in a growing field known as bloodless surgery. The approach was a religious preference for the Craver family, but is becoming a technique of choice for a growing number of doctors. The idea is to perform operations without using a single drop of donated blood.
The more foreign blood and the more foreign stuff you're exposed to, the more revved up your immune system is.
Which can lead to an inflammatory response that could impact the new organ. To keep that from happening, doctors limit how much blood they take for testing before surgery, modify heart-lung bypass machines to make components smaller, and even recycle blood.
We used what's called a cell saver, which captures any shed blood during the procedure, processes it, and puts it right back into the body.
Studies show using a patient's own blood cuts infection rates by more than half, and costs are cut as well.
They have a heart transplant program, and they also have a blood conservation program.
Now, in 2002, there were only about 70 hospitals with blood conservation programs like this. Today, there are 100. As more hospitals use the technique, the demand for blood goes down, and as we know, blood supplies are almost always tight, so using less is always good.
Pretty significant, though, a 50% less chance of getting an infection.
That's right, an infection plus all the other issues that might come along with donated blood. So,
all right, Dr. Max
good thing.
Gomez, thank you.
You bet.